I hope to everybody, the families are doing well. We are still a little bit in the COVID pandemic. So let's start by just making sure that we're all doing well and everybody is safe. This is an important topic, and I think as we've heard, the Secretary General continues, our new Secretary General continues to take the issue of women and women empowerment as something that is high on the agenda. We are at the Economic Commission for Africa. Your title here is Women, Economic Empowerment, Pandemic Response, Recovery and Resilience. We actually have Pandemic Response, Recovery and Reset. So where it's all ours, and I think this is all about women where we're resilient and we can reset. And then we talk about how we build forward better. And we like to use the word build forward better because we really believe we need to start looking ahead. And of course, we need to understand the past to build the future. But I think saying forward just gives a sense that we're going to get out of this and that we're going to get somewhere at some point. The co-chairs, Your Excellency Luis Guillermo Solis, the Interim Director and Professor of Kimberly Green, Simona Scapella, of the Global CEO of Edge Strategy. Thanks for having the ECA and myself in these discussions, an important one. My panelist, Karen, a longtime friend from the World Bank, and Justin, of course, huge fighters for women and gender empowerment. I think that all of us are here today because we believe in this cause and we want to make sure that we follow it. Dr. Linda Scott, of course, DP World Chair, Elizabeth Vasquez of We Connect, very happy to be with you on this panel and honored to be speaking. I think as we talk about women's resilience, the response, the recovery and the reset, the way we see it is the response, I think, on the side of women has not been as strong as we would have liked it. The response is when the pandemic hit, what happened? When the pandemic hit, the women responded. We responded to society by being on the front line as nurses, by being caregivers, by being mothers who had to stay home because kids were no longer going to school, so we became educators. And so the response on the women, and particularly the African woman, but I think it was for everybody, has been quite heavy. But at the same time also because women on our continent are particularly found in the informal sector. 49 African countries closed essentially their economies at the beginning of the outbreak. We were losing about $29 billion a month on that, but a lot of this were informal sector jobs, right? It was a transboundary trade where the women, again, lost their jobs. The women were not able to have immediate cash transfer systems. Only 17% of the countries on the continent had existing cash transfer systems to respond to the crisis. So the women essentially were pushed to the front line, both in our sort of professional jobs, in our sort of home jobs, in our educational jobs. But at the same time, the response globally, but in particularly on the continent, did not meet the sort of new obligations that had come. In some places, and we must give credit to those countries where we saw a look at maybe seeing how one could respond and protect the women. In Ghana, for example, the government of Ghana immediately decided that all healthcare workers will be put on a government insurance scheme, just in terms of being able to protect the healthcare workers. Whereas in Mali, for example, 2/3 of the healthcare workers were essentially unpaid care workers. And so, you know, when the situation hit, not only were they unpaid care workers, but they were on the front lines of what was a life crisis and a life disaster. In many places where women do not have access to the internet on the continent is quite sparse, but even sparser for women, only about 14% have access to the internet. The work that the Economic Commission for Africa has done has shown that businesses that had and were connected to the internet were able to survive much faster than those that were not. And so essentially, again, women in the response on the crisis were found wanting because we did not have the kind of infrastructure that was needed to begin to respond. In northern Ethiopia, for example, you know, more than 500 girls had to be rescued from child marriage because again, because of the burden of the kids not going to school where they were being fed, they became a burden at home. And so the response of the home was to say, let's marry them off. And so, you know, a huge effort in trying to say, how can we ensure that the girls don't get married off? Because one of the perks of sending your kids to school was that the families were receiving feeding. And when that stopped, then the girls no longer became an eligible, quote unquote, revenue earning asset for the home. So as you see, there was a lot of stress on the girl child, the young one who was at school and then lost connectivity because they couldn't go to school and didn't have internet, to the middle-aged one, or even, I don't even know if we should call them middle-aged, still young, who got then pushed off into marriage, to the vulnerable women, cross-border traders who lost their jobs, lost their employment, but were not connected to safety net systems. And then to the nurses that did not have insurance. So a whole risk of systems that needed a different kind of response. The continent has put in place systems now to begin to respond to that. Of course, the biggest response to the COVID pandemic is vaccines. We see the global glut on vaccines. We have tried to make sure that Africa, like every other continent, vaccinates its healthcare workers. But while the rest of the world has 1.2 billion people already vaccinated, Africa has about 27 million. Less than 30% of our healthcare workers have been vaccinated. So even though the G20, the ACT Accelerator, and the global community came together and created COVAX, COVAX was dependent on Serum Institute for vaccines. Serum Institute can no longer produce vaccines, or is producing for India because of the crisis there. So again, our nurses, our healthcare workers, our women are left without vaccines and still on the front lines of the crisis. So we need to find a new system for how we work on that. On girls' education, I think what, of course, particularly at the Economic Commission for Africa, we're doing is really we're running this Girls Can Code camps, where we're bringing 3,000 girls together across the continent in one go to begin to think of what kinds of ideas they can generate, what kinds of new platforms they can build through the internet, to begin to connect people better, to connect themselves with the rest of the world, and to eventually create jobs. So we have girls, you know, thinking because of the COVID, you can't go out of the house, their mothers are getting pregnant, how can they reach a doctor by telemedicine? And so they're designing all these apps, amazing work that's going on. So I think that in the response and the recovery, in particular, there is a lot of hope that we can get out of that. We're looking at new and innovative ways of designing agriculture and food systems so that people can continue to be more productive on the agriculture sector while being safe. The G20, of course, worked with Africa and African finance ministers on the debt service suspension initiative. Africa last year got about $5 billion, stands to get about 8 billion altogether from that initiative. I think what we have not done well as global institutions is see whether we can track whether some of those resources are actually going to women-led initiatives and young girls. In partnership with UNICEF, for example, Airtel and others, we're launching this sort of digital tools for schools. But first of all, we need to make sure that the schools and the students get back into school. A lot of policy advice is still being given about how you open schools safely. I think for most of us in the developed world, we see that, you know, in the United States now, Moderna vaccines and Pfizer vaccines can vaccinate 12-year-olds, so no need for, you know, the Saturday and Sunday morning COVID testing before you send kids to school. In the developing world, in Africa in particular, we're not there yet. So there is still a lot of tension around how one does that. Safety nets, redoubling on, you know, food for school efforts is going to be particularly important to save and keep those girls out of getting married, ensure that they can continue to go to school. I think initiatives on IT and digital are going to be important. January 1, the continent launched the African Continental Free Trade Area Agreement. A lot of the conversation was around how this will help and enhance particularly small and medium enterprise women who do a lot of the cross-border trading on the continent. Of course, with COVID in March, a lot of that hope and that ambition for the CFTA being a route into prosperity for many women has been contracted. But we're hoping that as we reopen businesses, we can ensure that women have access again to cross-border trading. I think some of the silver lining of COVID has been that we have now been able to actually streamline cross-border transportation, cross-border transfers with the African Union, with other NEPAD. We've worked on a green traffic lighting system, which borders are effective, which borders are not for COVID crossing, but also for business crossing. And that has helped us fast track some of the cross-border trading and customs work that we needed to do for the CFTA anyway. You know, for the 70 to 90% of the women who account for our cross-border trade, we need to continue to work with those women to see how we can bring them back and bring their businesses back into prosperity, but not only bringing them back to business, helping them have access to finance, and then maybe potentially access to better digital skills, and then becoming more formal so that they can benefit from much more services as we go in. So it's a very huge agenda. On the reset agenda, I think it's the biggest part of the reset agenda is the institutional agenda. You know, women and childcare, women out of work, how can we ensure that we provide the kinds of institutional childcare support that is going to be needed so that women can work, whether at home or whether they go back into offices, whether, you know, to begin to make sure that our nurses, the female nurses and the male nurses, make the same amount of resources. We still see a huge divide, even at the nurses level, when you're a male nurse and a female nurse in pay scales. Can we change those and institutionalize the change in that? And then, of course, part of the crisis has meant that, you know, health ministers have been at the fore of this conversation. In Africa, we are fortunate because many, over 70% of our health ministers are either all or deputy ministers are female. And so that institutional powerhouse of women in the health sector has been very, very helpful and useful. We need to continue building and getting more women into the institutional setting so that they become policymakers as we go forward. So on the reset is three big things. Is essentially the income gap, in ensuring that we have childcare for women who work, and then making sure that we have more women in institutions that make policy for women and for the global community. Thank you very much for listening to these few points.